Thank you for coming. I just want to remind everybody that's here that there is a sign-in right outside the door. If you missed it on the way in, we ask that you sign in on the way out so we can get it in the minutes who's here. Rick is somewhere in Indiana right now, so I have the pleasure. Anyone who knows me, not like I'm spitting that word out.
We love it.
First, we need to approve the January 3rd minutes. If I can have a motion to approve.
So moved?
Second.
It's been motioned and seconded. All those in favor?
Aye.
Aye. Opposed?
Aye.
Thank you, Larry. All right, the meetings for January have been approved. And our next meeting will be in the 6th Judicial District at the Fascist Center on March 6th of 2020. So look forward to hopefully seeing some of you or all of you there. And we'll move on to the welcome by the director. We're honored to have you here.
Okay, I know there was gonna be like a hidden joke in there, possibly.
I wasn't gonna do it.
Okay, no, just so you know, for the record, Larry and both Rick gave me a razzing at the Governor's Roundtable. Wonder if I'm gonna attend any more meetings this year. So, it's good to see you all. Happy New Year. And yes, I will be here moving forward because I can't take the pressure and all the razzing from you guys. But no, it's good to see you all. So just some few quick updates I want to share with you about what's going on in the department. As you know, we're full on and in session. We had our legislative breakfast this morning. I thought we had a pretty good turnout. Some of the things, and I know Sally covered last meeting, she talked about some of the governor's criminal justice reform and talked about some of those activities and things that are happening around that. And I was very honored to be a part of that group. What's happening now with that group is we are actually moving forward, and we have a meeting set, I believe, the end of February. Do I know when? No, but I bet you Joanna knows. But we are going to move into the next phase of this focus committee looking at racial disparities. We know that's an issue in corrections, and not just in corrections, but a criminal justice issue. All the same players will be at the table discussing the issues around racial disparity. As many of you know, I've talked about this in the past. It's definitely a systems issue. It's a corrections issue, but it's a systems issue. Everyone has a part of it, whether it starts from legislation to courts to law enforcement to corrections to parole. We have to look at all of our system to really truly address racial disparities. So I'm very excited that I get to be a part of that and be part of that discussion. And that's something that's near and dear to me. In terms of racial disparities, I just want to also update you. A couple months ago, I sent out a letter to all staff. All staff have to be trained in implicit bias in the next 2 years, and people are off to the races running and training people in implicit bias. We do have a diversity training that we do online, but we're doing implicit bias. We think that's really important for our staff to have that awareness. So I have mandated that everyone take the training. We continue to work with our diversity group. I'm going to kind of hopscotch around some of my topics. Part of, if you remember, some time ago, we have a racial disparity policy. And that policy was created to address some of the racial disparities we have across our system. And look where there are spots of those disparities. And so Sarah Finneran, who's our new research director, that is right over here, that we stole from CJJP, Steve, so Steve getting the ugly eyes guy this time. So we stole her. But she's going to have a report in the next couple of months that's based on what we said we do in the policy. Is we look at racial disparities across certain metrics, such as work assignments, who gets into programming, discipline, grievances, things like that. And we want to look at the institutional level and the district level. And if we identify that there's some disparities, the deputy directors, which would be Bill and Sally, will work with a specific district that may have been identified in a certain area or a specific prison and work with them and kind of lift up the hood and see what's going on. Sure. And if there's something going on in terms of we're introducing some type of bias, that we'll come up with an actionable plan to address it. So that report will probably be coming out in a couple months. We're just doing some kind of tweaks to it and some final, just kind of drilling down a little bit deeper in the data. We've had some governor roundtables. I think we've had 3 now. They have went really, really well. We've done ICIW, Rockwell City, and Anamosa. Thank you, Anamosa. They've been, I think, truly a success. They've been well organized. I want to thank Cord Overton. He's been a master in terms of logistics and making that happen. But I would tell you, I think in one at Rockwell City, one of the individuals that was incarcerated got a job on the spot. But more importantly, the 2 things is that we have the support of the governor. We have the support of the highest level of administration, that she is truly on board. She's talking to these individuals. She's very passionate about second chances and creating opportunities. We're in such a great position, and there's such good synergy around this. And I think also importantly with the employer panels is that there's a whole education piece that needs to happen around hiring people that have been previously incarcerated or criminal record under supervision, and what those benefits are. And actually talk about success stories, and that employers talk to employers about how successful they've been with hiring returning citizens. So we really think it's important we get around the state. We have 3 more. Get around the state and get the word out. And sometimes you can hear it from me all day long, talk about research and how employment and education is a pathway to assistance and things like that. But when you hear from your colleagues, right, other employers that are actually doing the work, I think it goes a long ways as well. So we'll continue to do those. The governor's attended to each of those. I attend them. Director Beth Townsend, our partner at Workforce Development. Like I said, I think they've been a huge success. So we'll keep you informed, when we have the next couple, and if you can join us, that would be wonderful. But again, one of those things I think we should be very proud of. Other things is a few other things. We have, and Sally may have mentioned this, we have a partnership with National Governors Association and Council of State Governments Justice Center. They're looking at 3 specific areas. They're basically making recommendation to new administrations, like for the governor, on areas of reentry, behavioral health, and employment. We're getting close to having those recommendations. Right now, the Council of State Governments is actually working with each district director to share what those recommendations are, to get their feedback, and then we should be having a final report in the next month. So when we have that, we will share that with you in those various areas. And it's basically, to improve what we're doing. What are areas, what are kind of hot spots for us that we want to pay attention to, and what we can do better in. So they're doing focus groups. They're actually meeting with district directors. They're talking to people in the system. So they're really doing a good deep dive. It's not a surface level type assessment. So I look forward to sharing that with you here in the near future. Also, another thing that we're doing, we have, as you're going to tell, we have a lot of plates spinning in the air, but they're all really good plates. They're like China, so they're really good. We have a partnership with Harvard and the Arnold Ventures. We're actually looking at both probation and parole conditions. One of the things that's nationally we're seeing is that a lot of agencies are reevaluating the conditions of supervision. Sometimes when you have too many conditions of supervision, it could be a setup. And so we want to review all of our conditions of supervision on the parole side and on the probation side to see if they're necessary. There should be a link to whether it be evidence-based or does it really make sense to have this condition, because anyone that's getting out, when you have a lot of conditions, it's hard, it's difficult, it's easy to violate. So we want to bring the experts in, and Sally's been a part of those conversations, and so is Helen Miller, talking about looking at our conditions and can we reduce them, can we make them more evidence-based, is there a direct correlation with good successful outcome and these types of supervision. So more to come on that. We're starting to have meetings on that. The other one is the Prison Research and Innovation Initiative. This is kind of a big deal. We're one of 5 states, so it's Colorado, Delaware, Missouri, and Vermont. And this is in partnership with Urban and Arnold Ventures. And so basically what the goal is ICIW is going to be our pilot prison. And so what they're doing is basically a comprehensive effort to build evidence and spur innovation within prisons. It's a 5-year project, and we're in the planning stage, so we have to make it to the implementation stage, which I'm confident we will. But the goal of it is to pilot strategies to promote the well-being of people, not only that are incarcerated, but that work in our prisons. and we know that's a big deal in terms of, corrections fatigue and things like that. So they're going to do cross-site data collections and assessments. They're going to do surveys. They're going to talk to individuals that are incarcerated. They're going to talk to the staff. They're going to look at the policy landscape to see if there's any policies that might be causing barriers or issues that we can do better on. They're going to do a strategic outreach, so it's going to get major national attention. They did a big press release on this. And they're going to bring awareness to the challenges of current prison operations and emphasize the importance of new, robust accountability measures and how we can be better at what we do. So that's really exciting. So we are in the planning stages of that, and it's going to be a great opportunity for us. And there's not a lot of work done to that level in terms of looking at culture, talking to individuals that are incarcerated, talking to staff to really understand what the inner workings of prison and how we can make that better. So this is going to be really big for us and for the country. The final thing is yesterday I was introduced to the Senate as part of my confirmation process. I did the walk. I didn't trip and fall, although some people suggested I do like a somersault down the stairs and pop up and say rock star, but I decided it wasn't a good idea. Court advised me not to. So I listened to him. So I got introduced, and then I went back to the Senate lounge and spoke with people about corrections and the great work we're doing. So we'll be moving into the next phases, which is a subcommittee, working with a subcommittee that will draw up a Senate file, and then the Senate will vote on my confirmation. It could take a week, it could take 2 weeks, it could take a month, we're not sure. So we will keep you posted on that, because that's kind of important. And so we're just gonna keep doing what we're doing, keep doing the good work, and I just wanna say I always appreciate all your support, and we have a lot of good things going on. So thank you for all that you do, and I want to thank all my staff for what they do too, because if it wasn't for them behind me, we wouldn't be as successful as we are. So that's all I have. Unless you have any questions for me or any comments or things you want to share.
Beth, the racial disparities training, who's doing that? Is that in-house or we?
It's in-house. So we ripped it from the courts in a sense. They started this, the court started doing implicit bias training. And so what we did is the diversity committee got together and said we want to do this statewide, but in order to be sustainable, we did training for trainers of trainers. So we train people statewide across the state in various districts and prisons so they can go back and train their staff. So we want to make sure we have a sustainable model, because we're always getting new people in, we have a lot of employees, so that's a high priority for me. So we'll continue to watch that. Probably in the next month or two, I'll probably give you some numbers and just tell you how many have been trained to date, and so we can just kind of keep track of that.
Yeah, good.
But very proud of the work that they put together and made that happen. So, good stuff. Any other comments, questions?
Regarding the pilot program you spoke of, was it your choice to choose ICIW, or was that part of the program that kind of dictated it would be? And do any of the other 4 states, are they looking into a women's prison?
We're the only ones who do. I think part of the reason why, because we have such a innovative female prison in terms of gender responsivity and the work that they're doing there, they wanted one women's prison, and I think that was, since we have such a great system, they wanted ours, and so that's, I think, a big reason why we were probably selected. Besides, we're a great corrections agency, but I think that was a big seller for them.
Are we gonna have to wait 5 years to get results, or?
Well, we'll start getting them. I imagine the first year, right now we're just setting up, right? We're setting up. Robin Bagby is gonna be she's gonna be our program coordinator for this. And right now the first meeting's the end of this month, where Urban and Arnold's coming in. We'll talk about logistics. They have a very structured timeline. I imagine after we get through the implementation, we'll kind of have a plan and idea what things are going to look like, and then we'll start. If we get more into the implementation stage, then we'll start seeing kind of what we're hearing. What are some of those results look like? We'll get more of an idea then. But now we're just basically kind of setting the foundation and the infrastructure to do the study. Other questions?
Larry, do you have any questions?
Oh, Larry.
I know, surprisingly, not here.
Okay.
Larry's not asking me questions because he's afraid I'm not going to come back next month.
Yeah.
All right, feel better, Larry. Thank you all again for your support. Really appreciate it.
Thank you.
Got it.
Awesome.
a prison population forecast by Mindy, and your last name, I'm not gonna guess.
Sarah Finneran. Yep.
I'm-
Sarah Finneran.
Oh,
Yep, so I'll kind
Oh,
of tee this
Sarah.
up.
we have Mindy on there.
Oh,
think.
yeah, I
Well,
apologize. I was worried about getting your last name wrong, not the whole entire name, sorry.
Sorry. No, I'll kind of help tee up this conversation a little bit. So some of you know me. My name's Sarah Finneran. I'm newly appointed research director for Department of
Hey,
Corrections.
Becky?
Yes.
Can you move closer to the mic or something? I can't, she's in the background. I can't hear her.
Okay, thanks, she's on her way.
We moved her, Larry.
Yep.
Yeah.
So this is Sarah Finneran, newly appointed research director for the Department of Corrections. I've been in my role for approximately 3 to 4 months. And prior to this, I was at the Division of Criminal and Juvenile Justice Planning, who have present Steve Michael, their division administrator, as well as Mindy Tenapple, their research coordinator. For the last several years, I've been the primary author on the prison forecast that Mindy's going to talk more about. So what Mindy has today is to communicate the recent findings of this year's prison forecast, and I can speak to anything historically that we've found. I'd also like to point out too that the prison culture pilot project that Beth was discussing at the women's facility, CJJP is actually going to head a lot of the analysis. They're the independent objective research entity who will be conducting focus groups and surveying both staff and inmates. So they're really our right arm for research. So with that being said, I'll turn it over to you guys.
Thanks, Sarah. So what you have in front of you, you have an infographic, and then you actually have our full report that what we did and was disseminated. Just to kind of introduce the infographic a little bit, the top pane is what the projections actually showed, and then kind of starting from the blue box down is current state within our prison system. So to kind of start off at the top, you can tell that the short-term projections actually show that our population is not going to increase that much, only 2.4%, which equates to a prison population of 8,675 at the end of the fiscal year in 20. And what's also important to note is all of these projections are based on new admissions, length of stay, and releases. And it also takes into account that there is going to be no legislative change over this time. So that's important to note that any changes that get made within the legislative session that is going to affect length of stay or releases are going to change these projections. So I know that there's been a lot of great work done historically that has reduced our prison population. So this just gives kind of current state projections on what's going to happen. Long term, we can see that it's projected the prison population to increase 17.7%, which would equate to 9,974 at the end of fiscal year 2029. What's interesting in the kind of the next section is you can see that the forecast projects only a 0.2% increase in new admissions, but it also projects a 58.4% increase in returns. So you can see we have a lot of opportunity there in the projected population. And in the graph to the right, you can see how those lines actually intersect, and returns are going to outpace prison admissions. In the blue box, you can see that over the past 10 years, prison releases to parole or work release have increased 87.9% and 34.3% respectively, while releases due to expiration of sentence decreased 28.4%. So that just shows that we're kind of redistributing where we release our prisoners to when their sentence is done. Next section down has to do with our special sentence supervision. So you can see that from FY 2010 to FY 2019, there was actually a 457% increase in offenders released to special sentence supervision. So you can see that number has gone up dramatically over the years. And then the bottom panes, the total average length of stay for prisoners has actually decreased 19.6% over the past 10 years. To shift to the far right pane, you can see violent and nonviolent prison admission types increased 16% and 9.7% respectively. And again, those are just strict numbers. That it's not relative to the population, which we know has increased over the past 10 years as well. So they've remained relatively stable over those past 10 years. And then to kind of finish up with that middle box, so in FY19, Relative to the state population, the number of convictions for African Americans were at a rate 7 times higher than were whites. And in the bottom, it says relative to the number of convictions, the prison admission rate for African Americans was only 1.2 compared to whites at 1.0. And what we were doing there, because it's the prison policy forecast, what we wanted to do is look at 2 different points in time. So what we did is we looked at the number of convictions was our first point in time, and then admissions was our second point in time. And I just want to clarify that that does not take into account anything that happened before convictions, and it doesn't take into account anything that happened after admissions. So length of stay, anything like that does not factor into this calculation, but we just kind of wanted to give, what is happening, at those 2 different time points, what is the disparity there. And it's only reported for African Americans because we only had the numbers to do it there. Our other population numbers are too low to give a stable prediction.
I think I have a disconnect.
Yeah.
On the upper left box, the 58.4% returns, I'm trying to equate that with a 30%-ish recidivism, but how does that, we're looking at a decade of data. Can you explain is that comparable to the recidivism rate?
So again, it's looking at all of the inputs. So again, the new admissions, the length of stay, and then the releases. So it's projecting into the future. Rates of recidivism is obviously going to play a role into that. So again, this is just a projection based on the numbers that we have now. So there is going to be projected an increase in returns. So again, any initiatives that we have to kind of adjust that recidivism rate or return rate is going to have a big impact on that number.
Okay, thank you.
Mm-hmm.
Any other questions?
I do, Becky, I do have a question, I guess, I guess it's more like 2 questions. But one, I know it's been a very serious concern about African American population being disproportionate. And is there any further breakdown on that as far as female versus male?
We did not do a gender breakdown. We strictly looked at the racial disparity. But that is data that we have and something that we could study further.
Okay, and then how about other minorities? Was there any research to see if we're developing kind of the same concern with other minorities in the state of Iowa?
That's an excellent.
Hispanic and those folks, or no?
Yeah, that's an excellent question. And in the full report, we do have the minority breakdown of all the numbers, but to calculate the RRI, there was not enough numbers to give a stable result. So we don't have the RRI on the infographic, but if you look in the full report, it does have numbers for other minorities.
Your report just basically is reporting the stats and the trends, I guess, at this point in time. Does your report have any recommendations as far as what we should be looking at?
Yes, there are some. Sorry to keep cutting you off. There are some recommendations within the report to kind of help address the increases that we're seeing, or things that could be done to kind of temper them in the future.
Can you briefly mention a few?
And that's at the very beginning of your report where there's a number of things listed there. Is that what you're talking about?
Yes.
Okay.
And then the other minority information is on page 16 of the report.
Which page again?
16.
Okay, thank you.
Yes.
Did you have something, Webster?
I just wondered if you can mention a few of those techniques you're talking about.
So the relative rate index, what that does is it takes, you have to pick a control population. So for the study, we picked whites as the control population. So what it does is it takes the number of convictions for each population relative to the state population. So we just use the 2018 census data to say, okay, the number of convictions for African Americans to the number of the state population over the number of convictions for whites due to the state population, and that's what actually gives us the relative rate index. And then when we figured new admissions, we actually took the convictions. So it was the number of new admissions to convictions for African Americans over the number of convictions and new admissions for whites, and that gives us the relative rate for new admissions.
Okay, thank you.
So maybe can I ask a question real quick?
Yeah.
So I wanna make sure that I'm understanding, so is it your interpretation then that much of the disparity really exists at the sentencing level?
When between these two time points, yes. So it's convictions and what happens before relative to new admissions into the prison system.
Got it.
And again, it just captures new admissions. We did not look at anything that happens on the back end, like length of stay or anything relative to that.
Perfect.
So
Oh.
then
Go ahead.
so with the recommendations,
Mhm.
the work that you're doing, all of this is being taken into consideration, make sure we're headed in the right direction.
Absolutely. We have to mitigate that.
Okay.
Special sentence supervision, help me with that.
So that is, there was some just legislation that was passed within the past couple of years that made it kind of either the 10-year or the mandatory lifetime. So that just means that all the prisoners coming out that get those will be followed for the rest of their life or for 10 years. So that increased burden is what's captured within that increase of population.
Well, I'll just speak up and just clarify something. Sarah's question asked about sentencing, which in my mind would go to those that were admitted into prison. So, and actually she really was referring to the conviction rate. That's where the big disparity is, the conviction. The sentencing is not as disparate as the conviction rate is.
And we have data on that?
Yes.
Those are the two numbers that are presented.
So, yeah, the 1.2 to 1 at the bottom of the page is that rate difference, which is only 0.2 versus the 7.0 of the conviction rate.
Gotcha. Makes sense.
Well, as convictions, I mean, we have data on the sentencing disparity versus conviction,
Yes.
because this is talking about convictions.
Yeah, but the lower number talks about the sentencing.
Yeah, that's
The
the admission rate.
The admission rate is really what we're looking at there. So
Mhm.
of the sentence that required a prison term is what we were looking at with the 1.2 versus the 1. Did I say that right?
I'm looking at admissions and thinking, let's say, Asian, white, black going, are they receiving the exact same amount of time for the same crimes?
It's not length of stay, it's only admissions.
Right, so
Yeah.
that is what is not here is.
Right, that's what I'm asking about.
All right, so you're asking about the length of the sentence.
Yes.
And that would be something that we could probably look at.
Yeah, I would be very interested in seeing that.
In previous years' reports, you've included a section on mandatory minimum type crimes, and there's a far disparity, going on with those, in that the convictions for African Americans under mandatory minimum type crimes, which have longer prison stays, because you have to be in for the
Yeah.
70%. And that was a really interesting component. So that would actually be in past year's reports too, Webster, where you could go in and look at those rates. It wouldn't have changed very much from last year to this year, to give you an idea, and maybe in the future, so go back to putting in.
Good idea, thank you.
Thank you.
Yeah.
All right, thank you very much.
Thank you.
Next, we'll have the budget update by Steve.
Okay. Good morning. Just a quick explanation on the 3 sheets that I gave you before we get into it in too much depth. The first sheet should have department on the top left. That's overall overarching of central office and the institutions combined. The second page is your institutions by themselves, and then the third piece would be central office, which would be all, not just administration, but all central office appropriations. So, very high level on that first sheet, the department. We'll get into a little bit more of the specifics, but the keys there are that our salaries. We are under the 50%, so this is through December, so we would expect to be at or below 50% at that point in time, and at this point in time, we're showing at 48%. So right on cue of where we need to be. As far as that first sheet, that's pretty much the only thing on that one, because I think we'll get into a few more specifics on the other sheets. So if you want to flip to the institution sheet, we'll dive in a little bit further. Once again, the personnel, we're at 48% of budget, which is once again where we would like to be. But some of those other large dollar types of areas that we do spend a considerable amount of money in, the drugs and biologicals. So if you're looking about halfway down the page, the 310, drugs and biologicals, we budget about $8.3 million. It's showing at 50%. We are actually, some of that encumbered money, we are actually a little bit beyond the 50%, so that's one of the areas that we're keeping an eye on, doing what we can, working with Dr. Greenfield to minimize that overspend, but that's one of those things that we're tasked to provide to our population. So if it does come in a little bit over budget, we've got to come under a little bit on something else. So that's one of the areas. The food is the next one right below that, the 311, about $10.7 million budgeted. We are just below the threshold of 50% for that item as well. And then the 403, the utilities, at just under $10 million. Once again, another area where we're underneath that 50% level. Overall, as you can see for the very bottom, we are at 50% of overall spending. There has been one thing that we have spent, and if you look at the equipment lines, which are the 501, 502, 503, 510, you'll see a fairly large dollar amount in the encumbrance column, $1.4 million. That's to pay for our radio project at ISP, so that's going to boost that overall number to that 50%. Otherwise, without that, we're probably below it. But that's completely spending that project down. So all those monies are incorporated there. So overall, for the institutions, I think we're on pretty good ground. We did start with a little bit of a deficit situation at the beginning of the year. We had some vacancy factor that we had budgeted in. In addition, we had some health insurance costs that came in a little higher than what had been anticipated. So that kind of started us a little bit in the hole. We're digging out. A few of the prisons are completely out. A couple of the prisons are very close, and we should manage by the end of the year. So overall, in very good shape for the institutions. So if we want to flip to the last page of that, the central office page. So once again, as I mentioned, this is not just our administration. This is our ICON spending. This is our county confinement, our federal prisoner education. All those pieces are combined into this one. So as you can see at the very bottom, when we get to the 41%, well, there's some things that we don't necessarily pay as we go. Some of the education bills come in a little bit later than what we would anticipate as far as it's not real time, I guess. But overall, we're in pretty good shape. Personnel, once again, 46%. We have had some vacancies here in central office that have contributed to that. We are in the process of filling those. Other major things, as I talked about the ICON spending, there's $2 million that's appropriated for that purpose. The majority of that goes to our monthly maintenance fees that we pay to ATG, who is our contractor. We have enhancement money that is set aside as well out of that $2 million. We are very close to already have spent that money at this point in time. So any additional enhancements and some that have already been planned and are ongoing will be paid out of other funds, not the general fund. So we've got money set aside for those purposes. Another area that I mentioned was county confinement, another area that we're kind of keeping an eye on. This is one that we actually did decrease last year. We actually allocated some positions for treatment to the community-based corrections districts, and also one position to central office and one to Newton Correctional Facility for treatment. So by bringing that amount down, we feel that we should be okay, but it's one of those things that the spending did creep up a little bit, so we're identifying some things as to how to manage that and hopefully keep that within the budgeted amount. Education's another area. The one thing that I would point out, the 205R, the revenue at the top, we've got some money budgeted. We're in the process of transferring some money from other funds. We've got canteen funds at our institutions that contribute to education. We also have the inmate telephone fund that we got the blessing in September. We're moving those funds right now as well. So that money will be moved and put on the books, which is why we're not at 100% currently for revenue projection, but that money is on its way. So overall, I think we're on pretty good sound ground for this year. Did want to get into a little bit of hiring as such. I know that's one of the topics that we like to talk about a little bit. So I just kind of pulled some numbers. Overall, our vacancy rate is just under 5.5%. I think that's pretty manageable when you think about, you got 3,500 employees. You think about 5%, that's just going to be your normal turnover through retirements, resignations. With the economy the way it is, we are going to have some turnover. So I think that's a manageable amount. Of that, I know one of the pieces that we've talked about is the medical piece. So I kind of pulled last July to now, where we're at with our medical positions. We had just over 31 FTEs that were vacant in the medical arena in July. That's down to 16.7 now. So we've made some progress. Of that, we also have 6 of those 16 that are already hired that just haven't started yet. So I think we've seen some gains there. We have had to strategically make some changes. Registered nurses are hard to come by in some places. We have changed or reclassified some of those positions to licensed practical nurses, which are a little bit easier to get started. At least it fills a void. We can always look to go the other direction down the road, but get some bodies in those seats. So as I said, medical, I think we're doing better than we have in a while. There still are some challenges. Of the vacancies, the majority of those that are still vacant are at Oakdale. That is our toughest place to fill, but considerably down from where it was. Security staff is the other area I wanted to talk about a little bit. We had approximately 96 correctional officers and senior correctional officers vacant that are vacant today. Of that, 41 have been filled, so about half have been filled. A lot of the rest of them are in the process of being filled. I think that's pretty good strides. We're not being made to maintain these large vacancies. It's a matter of filling as we go. Unfortunately, at the end of the calendar year is one of those areas when people tend to retire. So we did have a number of people leave towards the end of the year, so that's why that number may be up a little bit. But I feel good about the numbers that we're filling as such. So overall, I think our hiring is doing well. Community-based corrections, same way. We have made some gains in our staffing, our vacant positions. In July, it was about 66 positions, and now we're down to about 55. So making strides. And once again, there's some challenges there as far as filling some of the residential officers, which is our entry-level position there, that we're working through. But I think we're making gains there as well. And some of those are strategically being left vacant to make budget as well. We don't necessarily present on the CBC budget, but they're in sound position at this point in time. The amount that they're projecting to carry forward will be down from last year, but I think it will still allow them to do what we need to do moving forward. It'll be just a little more challenging going into next year. So that's kind of status of the current year, FY20. Did want to talk about the governor's recommendations for 21 that we have gotten back at this point in time. So we have about 4 different areas that the governor has recommended, either more money or an even swap. We had one package that was to realign positions between Iowa State Penitentiary and IMCC Oakdale for physician. The bodies have been moved, so they're in the opposite places, so we just need to move the money. So it's a zero-sum package. The security threat and drug interdiction package for $117,000. It funds a statewide position to gather information and investigate security threat groups and drug interdiction in our prisons. So we're happy to have that be recommended by the governor. We also had positions for treatment in both the institutions and also the CBCs recommended by the governor. Currently, we've got 4 correctional counselor positions at Mount Pleasant that are budgeted, and we've got 9 statewide. We haven't designated specific districts at this point in time. We're going to use a process to be able to evaluate where best to put those, but 9 correctional or community treatment coordinators to deliver treatment in the community as well. What we've been told, or what we've kind of been advised, is this is kind of a pilot for the state. If we can show those results that we want to show, put those resources in the right places, there may be the availability of additional funds down the road in future years to supplement the other districts and institutions. So, and then the last column is our salary adjustment. This is one of the areas that has not been part of the governor's recommendations in the past. Usually this comes at the end of the session through the legislature. The $5.6 million is not entirely what we need, but it is a chunk. We would estimate probably that's closer to $9 to $10 million probably overall, but to have $5.6 million day one that is being recommended is a strong message that it is important to keep our staff and maintain what we've got. So we'll hope to keep these funds, and if we can secure additional funds, would be great as well. So that's our general fund recommendations. We also did have a proposal in for kitchen replacement at Clarinda Correctional Facility, 2-year project. They've recommended $4 million out of the Rebuild Iowa Infrastructure Fund for the first year to start that construction of a new kitchen inside the walls at Clarinda. And then we also have recommended $500,000 towards building automation systems at 8 of our prisons. That basically, what that does is the brains behind all those systems that are operating, heating, cooling, humidity, fire control, all those types of systems that are running. There's upgrades needed, necessary at this point in time, so $500,000 towards those projects. Once again, doesn't entirely fund those projects, but gives us a substantial amount to at least start implementing changes and getting those done. So that is 21 governor's recs. Like I said, we're happy that we are receiving additional money. Everybody is in this. All state agencies didn't get treated quite the same. I'm not sure on the salary adjustment. I'm assuming everybody got proportional. But once again, we're happy that it's there to start with. We're not fighting for this at the last minute with the legislature. And we would hope that we hold on to that amount, or like I said, it improves and fulfills our needs. So that's the budget update for 20 and 21. Do you have questions or comments?
As you go through and put these together year to year, is there anything that tends to not be what you expect year after year?
As far as on the budget itself, some of those things do vary a little bit, and some of it comes between. Sometimes you're in a better position at the end of one year to help prepare yourself for the next year. So sometimes when that's not available, and during the last couple of years, it's been tight. So we haven't had as much room to do some of that. So sometimes you'll see increases in some of those budget lines for that non-preparation. So you didn't go out and procure or purchase $100,000 worth of food. Well, if you didn't do it at the end of the last year, you're going to need it this year. You're probably going to see an increase. Same thing with uniforms. You know, if you're not able to buy that stuff ahead at the end of the previous year, sometimes you'll see a little bit of an increase. Most of the other stuff we are pretty well versed or prepared, know in advance that something's going to be happening. Even such as we get pretty good notice on utilities increases at different places. We can budget and prepare for that. So those aren't necessarily surprises. So overall, I would say there's not a lot other than that flex between the two fiscal years. And then at the end, same way. Are you able to then, you know, procure and purchase some of those things that you either did or didn't the previous year? So within budget lines, that's pretty much. I don't know if there's a whole lot that surprises us otherwise. We're, like I said, we're able to plan for the most part. We know what our contracts are. We know what our food budgets are. We know what our inmate pay types of things, where those things are at. If we make a change, of course, that's going to definitely impact. But like I said, then we try to plan for that next year. Good question, though. Yeah.
The 640, Steve, on the treatment
Yes.
pilot, is that program you're talking about in the state for substance abuse? And
So that would be to, in community-based corrections, the
Mhm.
640 is to provide 9 additional positions to enhance our treatment and quality control audits that are going to be happening to ensure that we're doing everything with fidelity and delivering that treatment at the highest level. Once again, we haven't, I guess the way we're thinking is that there's going to be a competitive process probably for those 9 positions, where we would possibly put 6 positions in a larger urban area type of thing, and 3 maybe in a rural, so that we can once again get a true value of that impact of what we can do, and adding those treatment. But basically, it's capacity issues. We're just trying to deliver more treatment to more people.
Wherever you're losing people the most, or just overall, are you collecting any information on where these people are going, and are you planning for that in the future to kind of compete more? Or
You're talking about our recruitment
Right.
and losing bodies. I don't know that we necessarily do that. I think Department of Administrative Services does have some of that information as to where these people are going. There's limited amounts of things that we can do to prohibit that. The pay, of course, is already established for the classifications that we have. There are minimal things that we can do as far as recruitment or retention bonuses overall, and that's not something that we tend to use a lot. We tend to use those for targeted positions that we really have trouble with. But overall, I don't know that there's a key. I think the economy is just so good right now that there's other jobs that have, sometimes better hours. I think the one thing that we do have that competes against everybody else is the benefits. I think the IPERS, retirement, health insurance and such are very good benefits when you compare those against the private sector. So I think we've got some good things, and then we've got some challenges, and some of that, like I said, is the scheduling. We try to do the best we can with that. We do periodically look at how can we structure those to best meet the needs of our people. Of course, when there's opportunities for people to bid into other slots and stuff, we always make sure that those opportunities are out there for those people, because we know things change with when they start versus their life. So yeah, I don't know that there's specific. We don't know necessarily where they're going, which industries, or we just know that it's a very competitive right now.
That's all for me.
You kind of danced around something
Yeah.
that piqued my interest. When you talked about taking certain RN positions and allocating them to LPNs,
Mhm.
it made me think, and I don't know Iowa benefits or corrections benefits, but is there any possibility that LPNs could continue their education with some kind of help from the state? So once we capture an LPN,
Like
maybe.
tuition?
Maybe there's a way to be able to help.
Exactly.
Yeah, there are opportunities out there to do some of those things, where maybe they would start as an LPN, some tuition assistance and continuing their education to be able to maybe become an RN with us.
I'm just
or
thinking.
fill some of those slots.
Like a
Definitely something we can,
Coralville.
we can look a little closer at, as far as more opportunities. Yeah, Coralville's one of those tough.
Yeah, and if
tough
you
spots.
could get them at the LPN level and, keep them at least in the system, that might.
Absolutely. Yeah.
And the state does offer tuition reimbursement. It's just a long process. You have to be a state employee for a while to be eligible for that reimbursement. They don't want to do reimbursement for somebody that works for 2 years and then leaves once they get their tuition reimbursed. And that's also offered by University of Iowa Hospital and Clinics, who we kind of compete for labor with. So
Expected that they might have
Yeah.
the same. So when you say long process, what's a ballpark?
I think you have to work for the state for 10 years.
Oh,
Yeah.
man.
I can double check on that, but I know it's long.
At Des Moines Waterworks, what they do, after if you leave within 2 years, your tuition reimbursement, you have to pay it back.
Retention type
Might be
thing.
something.
And some of the bonuses and stuff are structured that exact same way. Retention and recruitment bonuses, if you don't stay a certain amount of time, proportionally you have to pay it back, so, on the last check, so. But something we can definitely look at and see if there's opportunities there, yeah. If we can keep our people and keep them moving forward and fill some of those slots, it's important.
And I think too, one of the things that we've talked about during some of our department head meetings is bringing together an advisory group, which includes not just central office, but staff across the state, and helping us develop better recruitment and retention. What are the things that we can be doing? Hearing from the staff that are actually, working there and ways to improve to keep staff. So that's something we're gonna be working on is having that group really explore we're a great profession, and some good benefits, we have great staff, great leadership, but people are still leaving, so we need to find out how we can recruit the right people and keep people. So we'll continue to work on that by this spring with that group.
Larry, do you have any questions?
I do not. Questions I have been asked, so.
Okay,
Okay. You want me to go ahead and move on to the other topic that I had?
that would be great,
Okay,
thank you.
fantastic. So we have the telephone fund was brought up at the last meeting that I was not at, the person telephone rates. So I didn't have necessarily anything to present. These changes were made a while back, but kind of wanted to give you the history of kind of what is out there. I think the article was talking about some jails that was referenced. And so the FCC has a rate that they have set for jails and correctional institutions of 21 cents per minute for prepaid or debit calls and 25 cents a minute for collect calls. We're currently at 11 cents, so we're considerably below that. The change was made, I think, back in 2016 calendar year, where we were at, I think, 14.5 cents. We lowered it to 11 cents. So we're well within that threshold, and I think we're at a comfortable level. I don't know that we'll of course look as we go forward of do we need to lower it, do we need to raise it, any of those types of things, but wanted to let you know, number one, that we're within where we're supposed to be. And then the other side of it is, the piece of that 11 cents that we get to keep for corrections. Back in September, we had a motion to approve some telephone rebate expenditures. So a good chunk of that goes towards education. So this year we had $500,000 that went towards education. So right back into where it needs to be with the II benefit. Another huge piece this last year was the FibroScan liver testing equipment that we did was about $160,000. Once again, better medical care, be able to better diagnose for our hepatitis C program. And then the inmate law library, once again, a direct benefit to the incarcerated individuals. Those are the major things. The other one that we've got that's still in the works is our inmate tablet program management. So doing an RFP to develop a program for inmate tablets. Once again, inmate benefit, that's what that fund is for, and that's what we use those funds that we get from our portion of that 11 cents. So, but wanted to kind of give you the broad history of, that we are within where we're supposed to be, because I think it's important, because that article definitely projected that there are some jails out there that, based on scale, It's hard to get to that 21 cents or whatever when you've got overhead costs and such, and you've got to have providers that want to provide to a jail that may only have 10 or 15 clients at any point in time.
So the county jails still have to follow that 11 cents?
They don't have to follow the 11 cents.
They do
11
now?
cents is for the state correctional, the
Yeah.
prison system. They're supposed to, per that FCC ruling, I believe 21 cents
21,
is,
okay.
is the highest that they're supposed to be. So
I think that's where some of the disparity was.
I think so.
Yeah.
You know, and when we're thinking about, we've got 8,000 offenders, you know, there's a lot of use. You're definitely going to have companies that want to compete for that business.
Yeah.
So.
Did you say the 11 cents? Is that whether the offender pays, or if it's collect, it's 11 cents either way?
So 11 cents is for, we don't have necessarily collect. It's all.
Oh, you don't do
it's
any
the
collect.
prepaid. So
Oh,
they have the money
okay.
on their account. Either they put the money on the account or somebody's put the money on the account for them
Gotcha.
at that point in time.
It's really good to know that that's going back into education for them.
That's what it's meant to do, and that's what the fund per code is. It's supposed to have inmate benefits, so we want to put it back where it could be best
I think
used.
that article was a little dispersing on.
Yeah. Yep.
So, thanks for clarifying.
Yeah, I wanted to just kind of give you that information. So, and as there are developments, if we decide that it's something we want to look at, or is the 11 cents the right place, we'll of course involve you guys.
Sounds great.
Okay.
Thanks, Steve.
Yep.
Awesome.
Thank you.
Yep.
Larry, nothing for Steve on phone?
Nothing.
Okay. We're at the point of public comments, if anybody has. Dr. Greenfield.
I'm not on the agenda, but I thought maybe if the board would allow me just a few minutes to piggyback on some of Steve's comments. if
Come
that's
on up.
okay.
Sure.
Thank you so much for your time. Again, I'm Dr. Greenfield, Health Service Administrator. As all of you know, health costs are soaring all over, and unfortunately, the Department of Corrections is not immune to that, especially given the fact that we don't receive any third-party reimbursement, Medicare, Medicaid. The fact is our patient population is aging. And with that, we're seeing far more chronic disease, especially arthritis and other types of pain conditions, for which those patients are prescribed what Steve had mentioned, biologicals. Those are types of medicines that are made to treat illnesses such as arthritis. They're unbelievably expensive, tens of thousands of dollars a month. We have one patient that has a blood disorder, and the cost of that one medicine alone is $50,000 a month. Our physicians are we have constant meetings with our director of pharmacy and our physicians to look at cost containment. So what we're doing now, our new medical director and I are actually making personal visits to the University of Iowa Hospital and Clinics and meeting with professorial physicians over our patients and what we can do for cost containment. Because sometimes there are alternatives that are more affordable. It's very strange in that some insurance companies are actually requesting name brands over generics. It's a very, it seems paradoxical and odd, but we've been able to do some cost containment in that way, but at the same time still offer high quality care. Our director of pharmacy is also actively looking at patient assistance programs. Oftentimes they're refused because our patients are incarcerated, but sometimes they're not. So we are looking at ways to cost contain. The other thing that we're doing is that we are trying to expand telepsychiatry and telehealth to our patients. We have a patient in Clarinda that may need to go all the way over to Iowa City for a wound check post-surgery, when in fact we could possibly do that via Skype, and that wouldn't so much help with our medical budget, but would indirectly help with cost containment. So this is an area that we are working with very rapidly to try to help the situation. And the good news also is, in terms of our healthcare team, at the current time, I'm very proud to say we have no openings for any physicians. We have no openings for any psychiatrists. We have no openings for any nurse practitioners. We have no openings for any dentists. And out of the 27 spots for psychologists, we have one opening.
Fantastic.
So I'm hoping that as we build a very strong, firm medical background, that might also help with our recruitment of nurses. And this is a national problem as well. When I talk to my cohorts in other states, they're having a very difficult time. But the bottom line is our pharmacy costs are very high. But we are constantly looking at some of these numbers on a regular basis, trying as hard as we can. But we have no control over who comes into prison.
Yeah.
And believe it or not, some people are actually getting revoked because of medical problems, which then falls on our lap to treat them and the expense that is. So it's a daunting task. Last year, somehow we made it.
You did.
We had no idea. We had no idea that we'd ever make pharmacy budget last year. And in March of last year, I was looking at Steve almost in tears, thinking, "What are we going to do?" But by the end of June, we'd made it. This year might be a different story. We're treating far more hepatitis C, and again, all these chronic diseases. We did apply, and we did get, and as many of you know, 340B pricing. We partnered with the Iowa Department of Public Health, and that means that we can buy our drugs, such as HIV drugs and Hep C drugs, at a markedly reduced cost. However, that savings is offset by the fact that we're treating more people. And we are one of the only states right now that I think is really aggressively treating at the level that we're doing. So we're proud of that, but we're treating far, far more hepatitis C patients than we used to. I'll just tell the board finally that we are trying our very best to, on the one hand, provide good, high-quality care from qualified healthcare professionals, but at the same time being very mindful of healthcare costs in our pharmaceuticals. But it's going to be a tough year financially, pharmacy budget-wise.
And we appreciate that, Doc.
Thank you.
Do you know from a federal standpoint of any federal facilities, do they get, are they in the same position, or is there different laws or governing requirements there that healthcare companies work with on the federal side, or is it?
I haven't heard of anybody having any better luck in that area. As a matter of fact, I don't think there are really that many states that have been actually able to get the 340B pricing grants that we did, and that's a huge help. So we're probably, in many respects, better off than some of our other states in that regard.
Do you have any data on whether or not, or the number of people that contract something after coming in?
Well, because we do screening on every intake, we're able to look at those numbers. And actually, the Hep C numbers are actually dropping. HIV numbers are dropping, but we do find on rare occasions that they come in or return and have gotten reinfected. But the numbers are very, very low in that regard.
I'm trying to get to is you are taking measures to make sure, even educating the inmates on how not to contract things while they're in there.
At a recent American Correctional Association meeting, they've put out free of charge boxes and boxes of information, patient information, pamphlets, posters, and I am on the list to get a box hopefully in the next few days. In turn, we're going to distribute that to all the healthcare clinics, and we have an active hepatitis C program, and that's one of the areas on our agenda too, is increasing patient education as well.
What can we do to help right over there?
Well, I think the bottom line is that we're eventually going to have to look at our pharmacy budget and see what it's doing, and we have good documentation of the level of disease that we're treating, the number of people that we're treating, but just like in your own health insurance and your own costs that you're paying at your own pharmacies, you can see that's going up and up and up. Ours is going to be the same, and we're eventually. You know, mental health, the budget's actually gone down. We went from 1.6 million in 2017 to 800,000. It's cut in half. So certain areas of healthcare costs, prescription-wise, have drastically decreased with the advent of a lot of generic psychiatric drugs. But other ones have they've gone up 200%, 300%, 400%. It's just hard to keep that budget then within that $7 million range. But we're really developing, I think, a much more firm relationship with universities. So we're not just some unknown entity. They're faces with these names, and we're really trying to foster that relationship as a good, collaborative relationship.
Yeah.
Thank you for your time.
Yeah, thank you.
Thank you. All right, any other public comments? Anywhere? Not seeing any. We move to open discussion amongst the board members. Does anybody? Nothing? Larry?
wanted to say I was very impressed last week with the presentation that Anna Mosa and the work that the warden and his folks did in getting that, and so I think it's a very great program, and Steph, you and your staff are doing a great job on it, so thank you so much.
Thank you.
I'll second that. Having been there.
Thank you.
All right, we've come to the point of adjournment. If I can have a motion to adjourn.
I move to adjourn.
So moved. Thank you, Webster. All right, all in favor?
Aye.
Those opposed?
Bye.
All right, the motion passes and we will adjourn until March 6th.
Sounds like you wanna stay longer or something.
All right, thank you, everybody.